we work with the government, we create a platform where we actually appreciate what they have, and if something is missing, we make sure that we provide. That's our partnership model, and it's working very well.
Today we have with us Dr. Santosh George, a transformation specialist who has been serving the most vulnerable children across India for the last 25 years. Cure International India is one of the national voluntary organizations that he and Dr. Mathew Vargehse initiated and lead from its inception from 2008. The goal of this unique initiative is to see India free of disability from clubfoot. Cure International India Trust has been working for over 11 years providing affordable and effective non-surgical interventions to permanently correct the clubfoot. Dr. Santosh George has Ph.D. in humanities from Madurai Kamaraj University in Tamil Nadu, and he continues to inspire many to spend an hour every day in the development struggle. Thank you so much for joining us, Dr. George, and I'm really looking forward to our conversation.
Thank you. Thank you.
So to begin with, I would like to ask, what was the idea on which the Cure International India Trust was established, and how has it developed since?
Yes, I really want to thank you for this wonderful opportunity. It was 2008 when one of my friends talked about clubfoot, and I have to confess, in 2008, I didn't know anything about clubfoot. But it actually created a little bit of curiosity in me, because the way he explained, he said, it's almost 50,000 children who are born with the clubfoot in India every year. So I said, then how come I never heard about it? I worked in this development field for so many years. And then he explained. But once I heard about clubfoot and heard that there is an opportunity to transform lives of so many thousands of children, I just jumped into it. Again, not knowing that this program is going to grow so large. I was lucky because I discussed this matter with Dr. Mathew Vargehse. He was the director of St. Stephen's, and he was very well experienced in this field in treating children born with clubfoot. Right. I learned from him, and he was insisting that we work with the public hospitals, government hospitals and medical colleges. And that's how actually I learned and got into this program. You don't believe it was in 2008 when I first heard. 2009, we approached the Delhi government. When we approached, there was not even the registered organization to take it up. But from the time Delhi government showed so much of keen interest, we registered an organization. Dr. Mathew Vargehse became the founding trustee, and then no turning back. First year we planned for 300 children, we got 800 children. And between 2010 and 2016, we signed agreement with all the states in India. Today we have 77,000 children. We have trained more than 6,500 doctors who are working in the government system. And we have created 324 designated weekly clubfoot clinics across India. So you go to any government medical college and most of the district hospitals where there is an orthopedic surgeon, our program is there. So it's very exciting. I don't know how it all started, but this last 11, 12 years of journey is actually kind of life-changing, not only for me, I mean, so many families affected.
Yeah, so I think as you have mentioned, even I was not very aware about clubfoot and when I saw the numbers that you have mentioned, that the kind of children who are affected, it was just mind blowing. Like I couldn't understand that, how come I've never heard of this. So I think there are a lot of people who are not aware about this.
Yes, I have a small model here. So it looks like this. It's by birth. Okay. So you can imagine the kind of trauma the young mother will go the moment she sees a child. There's so much of joy, but at the same time, when the foot is twisted like this, all the joy diminishes. Right. So, I mean, it's really kind of, I mean, I feel so lucky to be part of this program. And you rightly said, many are not aware, but that has been our effort to raise awareness, to provide treatment. And one day, I'm very confident we will eliminate disability from clubfoot.
Definitely. And you are doing some great work towards that. So thank you for sharing that. And as you have mentioned that you have been working, like you started with Delhi government. So on the same note, I would like to ask that since partnership plays a vital role in your entire work model, so what are some of the key benefits that the partnership with the governments bring to the table?
See, I mean, after working with the government for the last 12 years, I'm almost convinced that any development initiative, if you want to see success and large scale, we have to work with the government. It is easy. That's what I say after working with them for 12 years. Um, I don't think it's an impossible task. I hear from my friends that working with the government is difficult. Um, it takes time. It takes time to build a kind of a proper partnership and relationship and confidence. But imagine when we signed agreements with the Delhi government, all the Delhi government hospitals are open for us. Um, Let me say this example with the government of Maharashtra. We are in all the districts. And imagine for a small organization like us to be present in all the districts in Maharashtra and to reach out to all the children, if not for the government partnership, it's almost impossible. So what we do is our strategy is this. We talk to the government officials. If it is because it is health, we meet the health secretary. We convince the health secretary, the mission director, the health minister, and if possible, the chief minister. Once they understand that in their state, there are children born with a clubfoot, and there is an organization that has kind of a solution to this problem, they welcome. They welcome. And the advantage of this partnership, as I said, is the reach we get when we work with them. It's amazing. Because, see, to be very frank, before 12 years, even I didn't have any experience of working with the government. So I was very naive and I did not have any experience. And I didn't even have a model to follow. We just went. Let me also tell you, it takes time. It took 18 months for me to convince the Delhi government. I was going there almost every day. But once we signed an agreement with the Delhi government in 2010, the same year we signed agreement with the government of Karnataka and government of Tamil Nadu. 2011, we signed with 5 more states, including Maharashtra, Jharkhand, Kerala, and by 2016, we signed agreement with all the 29 states. So partnership has been amazing. The advantage again is, as an organization, we only complement, we fill the gap. Government already has doctors. Government already has the clinic space and the hospital. Government has the treatment material and the system to identify and refer. 4 things that are already there. That's what we discovered. But then people ask, then what do you do there? So we discovered there are 4 things that are lacking in a public health system that's actually failing the clubfoot program. What are those 4 things? Training the doctors, documenting the entire procedure, talking to the parents and getting them back and completing the treatment. And the 4th thing is the availability of the special shoe. So 4 things, that's what we offer in this partnership with the government. So government gives us 4, which is already there, and we put things that are not there or not so strong. So doctors, treatment materials, clinic space, the system to identify and refer the children to the clinic, that is ASHAs, Anganwadis, and RBS. The 4 things government put as an organization, Cure India, give training to the doctors that we do every year for every state. That's why we reached 6,500 doctors in the last 12 years. And we provide counselors who sit in the clinic, talk to the parents, make sure that they come back and complete this 5 years of follow-up. Third is we do document it. We have an electronic platform where we document the entire details, the number of children, their contact details, their treatment, number of times they visited, is there any complication? And this wealth of document has enabled our doctors to come up with research papers. It's amazing. And the 4th thing is there's a special shoe that is required to make sure that this foot is maintained in the correct position. So it's beautiful. So in this partnership. So after working in this area, all the other initiatives that I have taken, the same model we follow. We work with the government, we create a platform where we actually appreciate what they have, and if something is missing, we make sure that we provide. That's our partnership model, and it's working very well.
Yeah. So thank you for sharing the information around your entire partnership model. And I think, as you have pointed out, that it's very crucial to leverage the support of the government, because without them, it becomes very difficult to reach till the last mile and to spread, as you are working with almost all the states government. So it's very important that we leverage that expertise to scale our operations and to reach. I think you have maintained, as you have mentioned, all the districts, all the public hospitals. So thank you for sharing that. And moving further, I would like to ask that, can you enlist some of the current or past projects by the organization that you are proud of and which were able to create the impact that they set out to achieve for the children?
Several projects, several. We have very good partners. We have run several projects in the last 12 years. That's why we are here today. To mention one, I think our journey with the government of Gujarat is unique. I should also say that our journey with the government of Kerala, these are all kind of similar. We started almost in the similar time, 2011, 2012. Gujarat, I remember, in fact, the then finance secretary was presenting about some of the work she has led in her career. And in the same meeting, I was asked to actually present the Cure India model of partnership with the public system. And so when after I shared about the clubfoot program that we initiated, I think it was just a 3 year of our experience. She immediately asked me, why you are not present in Gujarat? So very emotionally she asked. I said, ma'am, we didn't get any opportunity. We're waiting. So she immediately called the health secretary and said, and also confirmed with me that I have to be in Gujarat next week. See, I mean, I was amazed. I went to Ahmedabad, met the health secretary, started the program, and worked with the health secretary. Later, it was the Mrs. Jayanti Reddy, madam. In short term of 3 to 4 years, we went from 3 districts in Gujarat to 33 districts in Gujarat. We were given a mandate that not even one child should be left without treatment in Gujarat. We started this when the Honorable Prime Minister was the Chief Minister in Gujarat. The kind of meticulous planning, implementation, and the way they kept us accountable for the work we did was a unique experience. So today we are present in all the districts. We are almost treating 90% of the children born with the clubfoot in Gujarat. So the entire system was activated. So I can tell many stories, but this is definitely a very unique project that we worked with the Gujarat government. And the uniqueness is also that 100% the entire funding was provided by the Gujarat government. They said, as an organization, you do not take any money from any other partner organization or need not worry about the funding. The special shoes, the training for the doctors, the counselors that we have appointed, the Gujarat government took care of it. A similar project is emerging in Kerala. It's not just emerging, it has been going on there for now more than 10 years. But as a celebration of 10 years, Kerala government also actually launched, the Honorable Chief Minister came and launched a program to completely eliminate disability from clubfoot in Kerala. So very unique programs are emerging. I can tell so many experiences, but we are celebrating.
It's very inspiring, the stories that you have shared. And I think, as we were discussing, the kind of reach that we get with the support of government is just incredible. So that story clearly shows that. So thanks for sharing that. And moving forward, I would like to ask that, to solve many of the global issues, you have brought all the 10 major initiatives under one umbrella, titled as V10. It's a consortium of 10 innovative programs that is changing the world for good forever. And you call this mission a transformation struggle. So could you shed some light on this?
Yeah. See, I've been in the development sector for almost 25 years. What I learned is, especially working with these children with the clubfoot, it's a problem. Clubfoot is a problem in India. What we have created is a program. So I say that, see, I've heard many people say that every problem has a solution. I said, fine, but the solution won't come just like that. For every problem, I say, there should be a program. For every problem, there should be a program. And so what I have done is, um, I've been so disturbed actually, whenever I come across this news that people are actually dying out of hunger. You know, my mother has told this story several times to me. My grandfather um, grew up in a very challenging situation. I'm telling this story, maybe something that happened, mm, I don't know, 90 years back. So unfortunately, when my grandfather was 10-year-old, his father passed away, leaving three of his siblings and this widow who's unskilled mother. So they grew up in poverty and extreme hunger. And my mother has said this story several times. Maybe it affected her. So every time she remembers that, she tells that story to me. The story is not that they grew up hunger, but the story is these hungry children. The eldest is 10 years, and all the other younger siblings, they go and take fruits from the neighbors. And she talked about this particular tree, which is guava, amrit, and they eat that, drink water from the stream, and go to school and study. The unfortunate thing is the neighbor cut that tree one day just because the children were going and eating the fruits. I mean, I don't understand whether people can do such things. And it's not only what happened 90 years back. When I moved to Delhi, almost some 17, 18 years back, we worked with some of this, again, extreme poor widows in Delhi. So once I visited this one colony in the western part of Delhi, I saw this tree, which is moringa. Moringa is drumstick. In southern part of India, we use this moringa leaf and the drumstick, which we put in sambar and other things. So I told this widow and her 4 children, see, take this leaf and put it, because moringa tree is a miracle tree. It is full of nutritions. And I know, looking at their face and hair, I know they are malnourished. So I told them, and they started eating that. And I'm telling you, you also, I mean, moringa tree is miracle tree. There's so much of tons of nutrition in it. And I could really see they're coming out of the malnutrition problem. But again, see, when I went back for one of my visit, the tree is not there. I asked them what happened to the tree. He said, Dekho, mera padosi ka hai, my neighbor's tree, he cut it. He cut it just because we are going and taking the leaf. I mean, so what I learned is problems are there. We have to come up with programs. I started something called We Plant. We Plant is planting fruit trees in large number in public places. Always fruit trees, always large number, always public places. 6,49,481 villages in India. Our dream is every village will have a public orchard. We have started. It's 10-year-old now, 11-year-old program now. We are establishing seed bank in schools and colleges. If not for the COVID, we worked with all the Delhi government colleges. 63 colleges are there. And 63 colleges have National Service Scheme, NSS. I trained, I don't remember exactly, at least some 150 volunteers who were trained to work with 600 schools that come under the North Delhi Corporation. Our idea was to establish 600 seed banks so that these children will save as many seeds as possible. 600 schools. Let me tell the story to you. In 2016, I worked with 100 schools in partnership with the Delhi government. When I first approached them and talked about hunger, talked about malnutrition, talked about making fruits available to these people, they did not understand. So I requested them, please give me an order, give me permission to work with at least 100 schools. Give me a chance, let me pilot it. Because I know they have 1,600 schools. I only requested for 100. And they asked me, what are you going to do? I said, I'm going to save 1 million mango seed this summer. So the director was a little amused, doubtful, but he gave me permission because of my persistence. And the arithmetic is simple. I got this permission. I went to 100 school. I organized a training program for them. The school teachers asked me, what do you want? I said, I want only 100 students from one school. 100 students from one school. So they gave me. And the students came back and asked me, what do you want from us? I said, you just save 100 seeds. Seeds have life. वो जिंदा है. It has life. After eating fruits, it's so nice, so delicious. Don't throw the seed, save them. That's the minimum thing we can do to the mother tree. And these children obeyed. They were so excited. They said, yes, what you're telling is correct. The seeds have life. We will never throw. Not only 100, we will save as much as possible. I said, just give me 100 at least. 100 multiplied by 100, 10,000. 10,000 multiplied by 100, 10 lakh is 1 million. So it was very easy for me to save 1 million mango seed in 2016-17. And you will be very encouraged to know, in Gujarat, there are 75,000 government schools. In 6,000 schools, they are piloting the seed bank. Imagine, in Tamil Nadu, in Karnataka, in Kerala, Delhi, Nagaland, Mizoram, Haryana, Uttar Pradesh, everywhere we are expanding. We are not asking money also. So many people actually ask, how much does it cost? I agree, it doesn't cost anything to change the world. Malnutrition will be a history in India. Hunger death will be a history in India. You read 9,000 people die in India just because of hunger-related issues. Hunger-related issues. Daily. I'm talking about daily, one day. If only we know where they are dying, definitely we would have gone and fed them. We don't know. 6,49,481 villages in India. Our dream is every village will have a public orchard. Every village have hundreds of fruit trees. And when children are hungry, there will be trees giving fruits to them. It is going to work. I can take the whole day and talk the stories. So like that, the clubfoot program, the We Plant program, which address the issue of hunger and malnutrition. We have a We Educate program where children in the margin, we know that they are going to drop out, but we will not allow that to happen. We have We Transform program for the widows and the young women with a disability. We have a program for We Fitness, we call. It's part of my health ashram program, health ashram. I'm so disturbed when I see children with unhealthy weight. 10% of Indian population has diabetes. Almost 40% of the people end up taking lifetime medicine. I tell the children, learn a little bit of health. You can save yourself from lifetime disease and lifetime medicine. Lifestyle disease is killing people, our young professionals. So that is We Fitness. There is another program called We Innovate. Because, I also come up with so much of ideas, but then I don't know where to take it. I don't know how to get a patent. I don't know how to actually make it kind of a profitable business. We are struggling, but I want to make sure that I create something. My dream is a patent factory where youngsters in India get an opportunity to come up with ideas and they come up with innovation. So I call it We Innovate. There is also another program called We Employ. The employment problem should be completely solved. There are so many people who approach me and I make sure that they are employed somewhere. You call some people, you guide these people, we help them in getting a CV, give a little bit of training, give a little bit of encouragement, put a little bit of hope, and they get a job. So giving employment is not a big problem actually. So that program is called We Employ. There is another program called We Walk. Only thing I'm addicted to is walking. I walk every time I get a chance. Every time I talk to people, I walk. Every morning I walk, every evening I walk. I encourage everybody to walk. I have a lot of experiences. I was in Jaipur after my meeting in the secretariat. From there to the airport, I walked because I had enough time. In my hometown, from my village, my house to the railway station, I have to catch a kind of a super fast train. It's 12 kilometers. I had enough time. I walked. I wonder why people are not walking. They're so addicted to scooter, two-wheeler and four-wheeler. So my dream is people start walking. I've written to the transport minister asking him to introduce a new official mode of communication, which is walking. It's so sad. We have to actually plead the government, please consider this as an official mode of communication where there is proper place to walk. Every road in India should have footpath that is dedicated for walking. So the last one is We Live. The 10th program is We Live. That is actually to facilitate body organ donation, harvest, and transplant. So 10 program, everything starts with we. We plant, we educate, we transform, we innovate. So I call it V10. V10. So W stands for water, E also stands for earth. But put together, we means we all. We all together should do greater things. You actually asked something very, very close to my heart. So I don't know where to stop. I keep on talking, but I put all this together and call it transformation struggle. You know, India had freedom struggle. It took many generations. It took many decades for us to get the freedom struggle. And the transformation struggle has just begun. And I invite everybody, young, old, elderly, retired, working professionals, everyone to join this, because together we will definitely win this struggle also. It's a movement. I dream a day when everyone participate in this transformation struggle of India. We need everyone, because the freedom struggle, we were fighting with somebody from outside our geographical boundary. And it was easy to actually, not easy, difficult, but then we had a time on the 15th of August, 1947, to say that, okay, now you go out of our geographical boundary. But the transformation struggle, the enemy is within. The enemy is often our ignorance, our attitude, our mindset, and our systems. But together, when we come together and fight, we will also succeed. If not in my generation, one day, but definitely we are going to overcome, and we will come out of this problem that we face, where many children have to live with the difficulties, many women have to live in difficulties, many families have to live in difficulties. This has to come out, and we will win. We will definitely win.
So first of all, thank you so much for sharing some of the personal stories that are really close to your heart. And I'm really amazed to see that kind of passion and the kind of pride that you have in your eyes and in your voice by sharing the kind of experiences that you have had. And I know that, there are many difficulties, many problems, challenges, complex challenges that exist in our society. But at the same time, rather than just thinking and complaining about it, you have started so many initiatives to bring a holistic change in almost every possible domain. And the kind of change, it's amazing to see. You have rightly pointed it out as transformation struggle, and I can totally see the emotions that you carry. So thank you so much for sharing that. It means a lot.
You know, I tell my volunteers, don't complain about what others are not doing.
Right.
You celebrate what you are able to achieve.
Totally.
We can do extraordinary things.
Thank you for sharing for that. And I think you have given the young people a lot of advices, like the walking part that I really liked. And I totally agree that we have become so accustomed of the modern means of transport that we are ready to sacrifice with our health just because of more comfort and a more lifestyle. So thanks. And I would like to now ask the last question for today. So, what is the big shift in the domain of disabilities in India that we need to look for and prepare the people around us?
Disability, you know, Government of India has an extraordinary program that was launched in 2013 called Rashtriya Bal Swasthya Karikram, the National Child Health Program, that take care of four things among children: the diseases, deficiencies, disability, and I forgot the fourth thing. Anyhow, so they identify, the RBSK team identify children with birth defect and children with development delays. So after that, after screening millions, I looked at this report after screening 43 million children in India. There are so many children who are born with birth defects, and there are so many children affected with the development delay. We launched a program 3 years back, 4 years back, called Children in India. So what we do is, our aim is these children with the birth defect, be it visual challenge or hearing impaired or development delays like cerebral palsy, Down syndrome, autism, including the major program we have called Clubfoot, the Cure India program. We are working with these children to make sure that they are enrolled in the public education system when they're 3-year-old. See, you look at various documents. We have this extraordinary desire to have an inclusive society in India, where everyone, irrespective of their whatever is their situation, they are included. But unfortunately, persons with a disability, there is very less scope because of the accessibility issues and also some of the patterns and that has been happening in India for so many years. For example, when we look at the special schools that we have, one may see that it is very good. But after hearing so many people and after looking at experiences of many of these children who grow up and came out of the special schools, they are finding it very difficult to get adjusted to the wider world, because in the special school they experienced special care, extra protection. But see, unfortunately, this world do not give that when they come out of those protected walls. Number one. Number two, what I have learned in all these years is, irrespective of whatever is the situation of a child, if you put that child in the same atmosphere of any other so-called normal child, this, because of peer pressure, this child also actually grow up extraordinary. I know children with visual challenge growing up in the local pre-primary school, becoming extraordinary good. No problem, no barrier, no fear of going out, mingling, traveling. So we are not completely criticizing the special schools, but our desire is every child with a birth defect, every child with a development delay should be enrolled in the public school when they are 3-year-old. Because if you look at children with visual challenge, almost 200,000, that means 2 lakh children get affected with their eye, maybe partial or full. But only 15,000 children can get access to the blind school. That means 1,85,000 children do not have access to special schools. What do they do? So we have created this program called Children in India, where we work with all these children. We get the list of children identified with all this defect and disability. And we work with the parents. We have this extraordinary team of 210 staff working in our organization. So they are trained as counselors. So they talk to the parents, encourage them. I mean, you have to meet some of the parents to understand their agony and anxiety. The social stigma they face it's actually inhuman. So, but our counselors talk to them, help them, inspire them, and tell them that we are there to work with your children. And we connect these parents together. And when they talk to each other, and when they see some of these children growing and doing extraordinary things, I mean, there's a greater joy. So the major shift in the field of disability is we are focusing on children, number one. Number two, we are focusing on inclusive education when they're 3-year-old. Because 3-year-old, even the so-called normal children, they all are willing to accept and willing to teach, willing to learn, and they get friends. So in the next few decades, we'll have a true inclusive country because of the effort that we are doing today. We may not be able to see the result immediately, even though we are seeing from the experience of parents, but at a large level, we'll see this effect maybe after 20 years. At least when we celebrate 100 years of Indian independence, the next 25 years, there'll be a truly inclusive society because these children are going to grow from their childhood and really get integrated into the larger society. So that's our dream. So that's a problem. So we have created a program. We are creating a program.
Yeah, that's a wonderful program that you have created, and I wish the same, that we become more inclusive and more, we bring more acceptance in our behavior. So yeah, that's very important. And on that note, I would like to say that brings our interview to a close. And I would like to thank you for joining us and sharing your insightful thoughts, experiences, and learnings. And I wish you all the best for your mission to eliminate permanent disabilities caused due to clubfoot and ensure affordable, accessible, and timely treatment, and all kind of dreams that you have just shared and the initiatives that you're working on. So all the best for all your future endeavors, and thank you so much for joining us today.
Thank you so much, Isha. And I really want to congratulate the entire CSR box and working with you. And I mean, it's very encouraging. We need partners. And I mean, we won't be able to do anything alone. And so I just want to really thank you from the bottom of my heart. Thank you so much and wish you all the best.